pathology of tumor.
And we only have 15 minutes, so we'll talk in short and some basic things about pathology of tumor.
To help you more understand about pathology, I will show you some basic concepts of pathology. First, apoptosis. There are 5 steps of apoptosis process. First, cell will damage. Second, cell begin to shrink. Third, the cell will break down and emit the signal to attack the macrophages. Next, cell breaks into several smaller pieces, and finally macrophage will recognize and remove them from the body.
Another concept that we have to remember is the hyperplasia, dysplasia, and neoplasia.
Hyperplasia is the increased number of cells. Dysplasia is the change of shape and size. Neoplasia is the combination of hyperplasia and dysplasia.
And neoplasia is the hallmark for cancer. As you can see in the pictures, is the increase of cell numbers and the different size and shape of one cell type. This is neoplastic progression. And we have with the normal cell under the stress of some factors. Here is the chronic inflammation. We will have the hyperplasia. After a while, it's developed into dysplasia. The dysplasia we can classify into 3 states. First, mild dysplasia. Second, the moderate dysplasia, and the finally is the severe dysplasia. And at the severe dysplasia, we can call it neoplasia or primary cancer. After 10 to 30 years, the cells is break through the fiber and collagen sac and spread out all of your body through the vein cells or lymphatic system called metastasis.
Next, tumor cell. There are 2 types of tumor cell, epithelium and mesenchymal. About epithelium, it is the cell is benign. I will call it adenoma or papilloma. If the cell is malignant, I will call it adenocarcinoma or papillary carcinoma. About mesenchymal, for example, fat tissues. If the cell is benign, I will call it lymphoma, and if the cell is malignant, I will call it liposarcoma. The term carcinoma implies epithelial origin. Adenocarcinoma and papillary carcinoma are the 2 examples for carcinoma.
Next is sarcoma. Sarcoma is the tumor which is have the origins is from mesenchymal. And this is the bone tumor, and here is the vesicle tumor. And this is important. This is a disease condition associated with the neoplasm. If you have a neoplasm of the visceral malignancy, especially in the stomach, you will have the condition of acanthosis nigricans or the hyperpigmentation and thickening of the epithelium. And otherwise, in the neoplasm of the thyroma, you have myasthenia gravis, poor red blood cell aplasia, and with squamous cell carcinoma of esophagus, we have an increase of ions. Next.
Acanthosis nigricans is a skin disease that characterized by dark patches in the body folds. It can be benign or malignant.
This is the picture. Next is the Barrett's esophagus. Is the syndrome that characterized by the replacement of the squamous cells in the esophagus by the columnar epithelium. And And we have some tumor markers specialized for each cancer. First, we have CA53 for breast cancer, and we have PSA for prostate cancer, alpha-fetoproteins for, you can see the fetal here is for fetus, is related, and hematoblastoma, tumor, yolk sac tumor, testicular cancers, and alpha-lymphopathies. This is the tumor we usually use in the hospital and in the blood test or the microscopic of pathology.
It is CA153. This is alpha fetoprotein and alpha-lymphopathic staining.
Some microbes can cause cancer. As you can see here, HPV can cause hepatocellular carcinoma, which is usually happens in a lot of countries, including Vietnam. You see here, HPV can cause cervical cancers in women, and Helicobacter pylori can cause some gastric adenocarcinoma. We have a question for you. 26-year-old woman visits a physician with complaints of vaginal bleeding after sexual intercourse. She started menses at the age of 14 years and has 32 days cycles. She noticed having unprotected sex with multiple partners. Cytologic specimens are taken from the cervix and vagina. On microscopy, the cervical cells have large nucleus with open proteins. Several cells have mitosis structure. What would likely to be present in the specimen that account for this finding? First, A, the double strand of DNA virus. B, the gram-negative diplococci. C, gram-positive cocci. D, single-strand RNA. And D, smaller cell covered with bacteria. Anyone know the question and can explain why? Please raise your hand. The answer is A, double-strand DNA virus, because this case is probably she is infected by the HPV virus, and she highly has the percentage of cervical cancer with the symptom of open protein, several cells have mitotic picture. She also has bleeding here. She has unprotected sex because this is a trans sex disease.
Next, the mechanism of development. The combination of environment agent and inherited genetic factors can cause tumor cell and develop cancer. There are two kinds of mechanism of development: acetogen activation and DNA repair, oncogene and tumor suppressor genes.
This is carcinogen activation. With the carcinogen factor, it will damage the cells and then make the cell in multiplication become malignant tumors. There are several carcinogens. You can see that smoking can cause lung cancer, or alcohol probably cause hematocarcinoma. And another, so it will make the increased expression of the oncogenes, so the cell will be damaged, or the down expression of the suppressor gene. So the combination of two genes that will have the result that we can probably have cancer. Next, we will talk a little bit about the in the general rules, the morphology of the cancer cells you see here is the large nucleus, irregular size and shape, and the nucleolus is prominent. Now we're going to the center of the cells. We have the irregular surface and the enlarge of the volume of the cells. Here you can see it's a high density because the protein is condensed to form the chromosome for the division. And the point here is the ratio between nucleus over the cytoplasm is over 1. Next is the abnormal in the spindle formation can affect the mitosis. We have some in the cytoplasm, we have accumulation of ribosomes and mRNA shows it's basophilic. And as you can see in the pictures, it's green. It's blue, so it's basophilic expanding. Sorry. Next, we have some other organs in the cytoplasm, like the granular and endoplasmic reticulum or granular endoplasmic reticulum, and a high amount of nicotine characteristic of malignancy. In the cell surface, we have the change of the receptor and the receptor sensitivity to the ligands. We may have the increase of transport of nutrients to produce more nutrients for tumor cells. Next, with the tumor, with the origin is from neoplasm, which is the carcinoma, we will see the desmosome and tight junction, which is a Hansen molecule, and but in the sarcoma, we won't have it. And we also have the increase of the vascularization. The tumor cell will provide a tumor angiogenesis factor to increase vascularization function. Next is the hormones section.
To finish the presentation, I will tell you the consequence of tumor. There are two effects of consequence of tumor: local effects and systemic effects. Local effects have effect of location, effect of functional activity, and effects of acute event. The effects of location you see in this picture, it is ulcer and bleeding, and fever infection.
We have Helicobacter pylori here.
Effect of functional activity is destroy the adrenal gland and cause Addison disease. Effect of acute events, it can cause internal bleeding. And finally, systemic effects include paraneoplastic syndrome and body wasting.
Thank you for listening.